Ever wondered what all those codes on your medical bill actually mean? From doctors' offices to hospitals, the U.S. healthcare system relies on a complex coding language that determines what care you receive and what gets paid. In this breakdown, we'll demystify three core components: CPT codes, ICD codes, and modifiers. Understanding these isn't just for billing specialists, it empowers patients, too. Medical billing in the United States involves a detailed system of codes. These codes ensure healthcare providers get paid and insurance companies understand what services were performed. Among the most important are CPT codes, ICD codes, and modifiers. Together, they translate your doctor's work into standardized data for billing, records, and insurance. Imagine thousands of doctors describing services in their own words: chaos. Codes bring consistency. They help insurance payers know what procedures were done, why they were necessary, and how much to reimburse. Without these codes, communication between providers and insurers would be a mess. CPT stands for Current Procedural Terminology. These codes describe the services and procedures provided by medical professionals. Developed by the American Medical Association, AMA, CPT codes are essential for identifying the what of a healthcare encounter, such as a physical exam, surgery, or lab test. CPT codes are 5-digit numeric codes. For example, 99213 is a common code for a routine office visit. Each code represents a specific service, with detailed descriptions maintained by the AMA. CPT codes are updated annually to reflect changes in medical practice and technology. There are three CPT categories. Category I codes represent most common procedures. Category II codes track performance measures and quality of care. Category III codes are temporary and used for emerging technologies or services. Most billable services fall under Category I. If you visit your doctor for a standard checkup, they might use CPT code 99214. This tells your insurance it was a moderately complex visit. The code helps determine how much the provider will be paid and what your copay might be. While CPT codes explain what was done, ICD codes explain why. ICD stands for International Classification of Diseases. These codes document the patient's diagnosis or condition and justify the medical services provided. ICD codes are managed by the World Health Organization, WHO, and used globally. The current version in the US is ICD-10CM, with CM standing for clinical modification. It offers more detailed diagnostic information than previous versions. An ICD-10CM code may look like E11.9, which stands for Type 2 diabetes without complications. The letter indicates the chapter, E equals endocrine, and the numbers drill down to more specific details about the diagnosis. ICD codes support the medical necessity of services. Insurance companies use them to determine whether a treatment is appropriate. Without a valid ICD code that matches the CPT code, a claim can be denied. Beyond billing, ICD codes help in public health tracking. By compiling diagnosis data, agencies like the CDC monitor disease trends, evaluate healthcare effectiveness, and plan public health responses. Modifiers are 2-character codes, letters or numbers, attached to CPT codes. They provide extra information about a procedure or service. Modifiers explain circumstances that could affect payment, like multiple procedures, unusual situations, or reduced services. Let's say a surgeon performs a procedure on both arms. Instead of billing the same CPT code twice, they'd use one code with modifier -50, indicating a bilateral procedure. This alerts payers to adjust reimbursement appropriately. Examples of CPT modifiers include -25, significant, separately identifiable service on the same day. -59, distinct procedural service. -26, professional component only. These modifiers help clarify the situation without needing separate codes. A patient receives an EM service, like a consultation, and a minor procedure during the same visit. Without the -25 modifier, the insurance may only pay for one. With it, the provider signals that both services were necessary and distinct. Imagine two procedures typically done together are done separately due to unusual circumstances. Modifier -59 tells the payer these are distinct services, not bundled, and deserve separate payment. Some procedures include a global period, meaning post-op care is bundled. Using modifiers like -24, unrelated EM during post-op, or -78, return to the OR for a related problem, ensures correct billing when new issues arise. Medical coders, billers, and healthcare providers use CPT, ICD, and modifiers daily. They ensure compliance with insurance rules, accurate billing, and proper documentation. Coders require extensive training and certifications. Mistakes in coding can lead to claim denials, underpayment, or even fraud investigations. That's why coders must follow strict guidelines and stay updated. Compliance audits are routine in large healthcare systems. Patients see these codes on explanation of benefits, EOBs, medical bills, and insurance paperwork. Understanding the basics can help you spot errors, appeal denials, or ask informed questions about your care. Insurers often require prior authorization for expensive or complex services. CPT and ICD codes are submitted during the approval process to verify medical necessity and treatment details. Incorrect or mismatched codes can lead to claim denials. Patients and providers can appeal, but it often requires resubmitting the correct CPT and ICD codes with supporting documentation. With the rise of virtual care, telehealth CPT codes have expanded. Codes like 99443 now represent remote services. Modifiers like -95 or GT signal that the visit occurred via video or phone. Visits are coded based on complexity using CPT codes like 99281, 99285. ICD codes specify the reason for the visit, such as chest pain or trauma, while modifiers may describe timing or unusual care circumstances. Surgical coding is complex, involving CPT codes for the procedure, modifiers for context, like multiple surgeons or return to OR, and ICD codes for the diagnosis that justified surgery. Imaging procedures often use CPT codes with modifiers like -26, professional reading, or TC, technical component. This distinguishes who performed the test versus who interpreted it. Labs use CPT codes for tests and ICD codes to explain what condition required the test. For example, a lipid panel might be CPT 80061, with ICD 78.5, hyperlipidemia, as justification. Psychiatric services have specific CPT codes, like 90837 for a 60-minute therapy session, and must include ICD-10 codes like F32.0 for major depressive disorder. Modifiers may clarify telehealth delivery. Preventive visits, like well-child exams, use CPT codes such as 99392, often paired with vaccine codes. ICD codes might include Z00.129 for a routine child exam with no abnormalities. OB visits and deliveries use specific CPT bundles. Modifiers clarify global maternity packages versus single visits. ICD codes document the trimester, complications, or outcomes like live birth or miscarriage. Pain management coding involves using CPT codes for procedures like epidural steroid injections, often with modifiers to show side, left, right, or sedation use. ICD-10 codes describe chronic pain diagnoses like M54.5 for low back pain. Accurate use of codes and documentation is essential to ensure proper reimbursement and reflect the clinical reason for treatment. Coding for chemotherapy includes CPT codes for drug infusions, administration techniques, and time-based services. Modifiers may indicate extended or complex sessions. ICD-10 codes like C50.911 describe specific cancer diagnoses, such as breast cancer. Accuracy is vital to reflect patient care, support billing, and comply with oncology treatment guidelines. Orthopedic coding uses CPT codes for X-rays, joint injections, and surgical procedures. Modifiers show laterality, left, right, bilateral, and whether services were staged or repeated. ICD-10 codes identify musculoskeletal conditions like fractures, arthritis, or sprains. Proper coding supports accurate billing and reflects the complexity of orthopedic care provided. Coding audits verify that billed services match documentation. Errors like upcoding or misusing modifiers can result in denied claims or even legal consequences. Regular audits help detect fraud and promote accuracy. Coders must ensure each claim is supported with complete, truthful documentation to maintain compliance and avoid penalties. Understanding CPT, ICD, and modifier codes is crucial in medical billing. Though complex, these coding systems ensure services are properly recorded, reimbursed, and understood. Whether you're a healthcare provider, patient, or billing professional, knowing the basics helps you navigate and advocate effectively within the U.S. healthcare system. Ever looked at your medical bill and thought, what do all these codes mean? Whether you're a patient, provider, or billing professional, understanding CPT, ICD, and modifiers can help you catch billing errors, advocate for better care, and ensure accurate insurance payments. Checkmark: learn how these codes shape your care and costs. Checkmark: real-world examples from doctor visits to surgery. Checkmark: tips to avoid denials and spot errors on your EOB. Right finger: start decoding your healthcare today. Read the full guide.